Good afternoon. I'm Catherine Santoro, and I'm very pleased to welcome you today to this webinar, The Future of Employer-Sponsored Insurance. Employers have long played a central role in financing health insurance coverage in the United States. However, intense pressure to control costs in recent years, coupled with the Affordable Care Act's requirements and associated costs, have led to countless predictions and speculation that this system is on the brink of extinction. Yet many employers and insurers are responding to the cost challenges and regulatory and policy uncertainty by redesigning plan models and launching private exchanges, not by dropping coverage altogether. We've assembled a panel of experts today to help us understand how provisions of the ACA and new tools to manage costs are shaping what the employer-sponsored insurance landscape will look like in the years ahead. Before we begin, I want to thank NIHCM's President and CEO, Nancy Chalkley, who helped guide the content of today's webinar, as well as my NIHCM colleagues, Katie McDonald, Carolyn Myers, and Amanda Parker, who provided assistance with communications and logistics. You can find biographical information for all of our speakers, along with today's agenda and copies of slides on NIHCM's website. I'm now pleased to introduce our first speaker, Paul Fronston, Senior Research Associate with the Employee Benefit Research Institute. He's also Director of the Institute's Health Research and Education Program and oversees the Center for Research on Health Benefits Innovation. Paul?
Thanks, Catherine, and thanks to NIHCM for including me on this webinar today. In the short time that I have, I'm going to go through some very recent trends in health benefits and then basically set the stage for some more detailed information that Howard and William are going to provide in terms of what we may see down in the future for employment-based health benefits. When you take a look at the slide, and hopefully everyone on the webinar has seen some version of this in the past, it's one of the main drivers of what employers have been, why they've been changing their health benefits. Even though premiums have been increasing at single-digit rates since about 2004, they're still outpacing inflation and worker earnings increases at about twice the rate. So it's something that employers, despite the single-digit increases, are heavily focused on. It's one of the reasons why you see fewer workers with health benefits. You can see that since 2000, the percentage of workers with employment-based coverage, either from their own job or through another family member, has been falling. It was as high as almost 76% back in 2000 and down to just over 68% in 2011. And the black line below that shows the percentage of workers that are uninsured, and you can see it basically bottomed out at around 15% back in 2000 and is over 19% now. So you've got those trends happening, and you somewhat attribute those trends to the prior slide on increasing costs, but there are other factors involved that you should be aware of. One being we're already seeing an increase in the percentage of workers employed on a part-time basis. That's that green line in the center of the chart. You can see it basically bounced around between 16 and 17% for almost 10 years, and starting in 2008 began to increase, and between 2007 and 2011 went from 17 to 22%. There's lots of concern that employers are going to cut people's hours as a result of the Affordable Care Act and the mandate requiring that workers working 30 more hours be provided coverage, but this is a trend that's already been happening independent of the ACA. And another reason why we've seen the percentage of workers with employment-based coverage drop has to do with structural change in the economy, where there are just fewer manufacturing jobs, and manufacturing jobs have always been more likely than just about every other industry, I think the exception being the public sector, to provide health benefits. So simply shifting workers to part-time and simply shifting workers from manufacturing to other jobs will reduce the number of workers with employment-based coverage. We haven't seen since over the better part of almost the last 10 years, we haven't seen fewer employers offering health benefits. For the most part, it's been bouncing around 60% since 2005. with the exception of 2010, which I'm not sure I believe that increase in 2010 and then subsequent decrease, but it is expected to decline. The Congressional Budget Office is predicting that come 2019, there will be 20 million fewer people covered by employment-based coverage. This is just one scenario, and I certainly encourage you to check out the source. There's a link at the bottom of the slide. I know the slides will be made available after the call, but you could. This is part of a larger report where the CBO models out various scenarios and presents 4 of the scenarios they modeled out. And in all fairness, I'm picking the worst scenario here where they show the 20 million fewer people with employment-based coverage. They do have one scenario of the 4 where they show more people with employment-based coverage come 2019. But the expectation for the most part is that there'll be fewer people with it. Some recent trends in what benefits have looked like. We've been seeing increases in cost sharing across the board. This slide shows you the average deductibles for employee-only coverage and a PPO by firm size, and you can see that the average deductible in smaller firms is over $1,200. Again, employee-only coverage, not family coverage. Family coverage deductible is much higher. Larger firms, the average deductible is up to $563. And keep in mind, this is PPO coverage. Does not include consumer-driven health plans. Does not include HSAs, for example, which are known as high-deductible health plans. So even outside of the high-deductible health plan space, you see deductibles over $1,000 already in the small group market. Cost sharing to see your doctor has been going up. The percentage of workers with coverage that are paying between $20 and $30 to see their primary care physician has gone from 42% to 58% over the course of only about 6 years, and the percentage with a $30 copay has gone from 8% to 19%. There's a similar slide I don't have here showing the same trend for specialist office visits. You see co-payments going up for prescription drugs, especially for the non-preferred drugs, though even the preferred drugs, you see them going up. For generics, they're basically staying the same. And you're also seeing a movement to co-insurance when it comes to prescription drugs. And you can see how few people have co-payments at this point, and how many are up to, with co-insurance, up to 75% as of last year. And there's been this trend to consumer-driven health plans. It started in 2001 with health reimbursement arrangements. HSAs came along in 2004. There's not good data before 2006 because for the most part there were so few people in these plans, but a decade after they were introduced, there's 19% of the working population, at least as of last year, probably more this year, enrolled in some type of consumer-driven health plan. You could argue that that's both it's a small number given the potential to be much higher, but it's also a relatively large number given that a decade ago it was in large part zero. There's also a movement to something called value-based insurance design, which some of you may have heard of. The basic premise is to align out-of-pocket costs with the value of health services. So higher value health services would have lower out-of-pocket costs associated with them. And as of 2 years ago, 23% of employers reported offering some type of VBID approach, but over half are considering introducing it over the next 3 to 5 years. So that's something to look out for. The Affordable Care Act completely changes the playing field moving forward, and this is something that's got employers' attention. Workers don't have to worry about their pre-existing conditions anymore. There's limited age rating. If you're below 400% of poverty, you get a subsidy. It basically wipes out age rating because your premium is capped at a percentage of your income, and you can see what those ranges are here. There's theoretically more choice of health plan, and we'll see how much choice it really is. We're starting to see the states announce how much, the choices. Standardized choices may make it easier for people to pick a plan, and essential health benefits may make it easier for people to pick a plan. And employers, there are some at least thinking that maybe I don't need to offer health benefits anymore because my employees can get it on their own. The initial reaction, I think, though, was when the Affordable Care Act was passed, some employers said, I could get out of this and it's only going to cost me $2,000. But reality set in right away. Reality being that employers have already been voluntarily offering these benefits in the absence of a mandate since as far back as World War II. And they've been doing so to be competitive in the labor market. They're concerned about recruitment and retention. They're concerned about the health status of their workers, especially as it relates to productivity. And none of those concerns have abated. Employers are still concerned to this day. And even when we had 10% unemployment back in 2010, you didn't see employers abandoning health benefits. There were still some employers that were concerned about recruitment and retention, and they were always concerned about the health status of the workers and how it affects productivity. There's a fear that if employers drop coverage, they would the $2,000 penalty would increase. They haven't seen the public exchanges yet, so they're lacking some confidence. And they can't simply go to the exchanges until at least 2017. So while the initial reaction was to drop coverage, and then reality set in that it's not so easy, this whole concept of private exchanges, which you may have started hearing about because it's gotten a whole lot more attention, may become the middle ground between the status quo and employers completely dropping coverage. But it's hard to ignore a chart like this, and I'm always skeptical about surveys of employers to get their opinion as to what they're going to do in the future. This is a survey done almost every year back to 2003 by the National Business Group on Health and Towers Watson, where they ask employers about their confidence that they will be offering health benefits a decade from now. And you can see what's happened to employer confidence. It's eroded. It's gone from 70% 2007 down to the low to mid-20s just in the last couple of years. And I think really what this represents is that employers, they just don't know. They can't say for sure that they'll still be offering health benefits a decade from now. But they just don't know. They're sort of stuck in limbo until next year. The public exchanges aren't up and running just yet. Private exchanges are in development, and they're basically taking a wait and see approach. But there's a lot of skepticism, and there's also a lot of interest in moving to some type of defined contribution strategy. Employers have been interested in the concept of defined contribution health benefits for over a decade. According to this survey of human resource officers at mostly Fortune 500 companies just 2 years ago, 36% said that they were giving serious consideration to moving to a defined contribution strategy over the next 10 years. They never moved in this direction because they, for the most part, couldn't. There was no viable alternative to employment-based coverage where they could give workers money to go buy insurance. So instead, they gave workers money to go buy health care through health reimbursement arrangements and then health savings accounts. But now that the playing field has changed, this whole idea of defined contribution health is returning, and private exchanges may actually be the vehicle to allow it to happen. But I think what's really important is the dynamics. The fact that, I like to joke around and say employers generally don't want to be first, but they don't want to be third. There's a follow the leader or Me Too effect that you see playing out, and just because you won't see a lot of employers in private exchanges next year doesn't mean you won't see a lot of them in private exchanges, say 10 or even 20 years from now. And these are some of the surveys that try and get at employer behavior and how it's influenced by what other employers are doing. I already mentioned this whole concept of defined contribution health is not new. Some would say that it's really it's the 21st century version of what a cafeteria plan was envisioned 30 years ago. But the Affordable Care gave it some renewed interest, and you had the work that Alan Enthoven did around managed competition many years ago. You had reports come out not just from EBRI on private exchanges last summer, but from the ERISA Industry Committee and the Committee for Economic Development back in 2007, before the presidential election that brought us the Affordable Care Act, where those two organizations basically put out reports on their vision for health reform, which included, they didn't call it private exchange, at least I don't think they did, but it included that vision of some type of exchange combined with a defined contribution or some type of contribution. What is a private exchange? And the other speakers are going to get into this in more detail, so I don't want to spend a whole lot of time on it, but it's basically a private business that sells insurance products to consumers through some type of web-based portal, and it's typically operated by insurance brokers, benefit consultants, or insurance companies. They offer the use of defined contribution health plans. They don't have to. They expand employee choice. They provide decision support to help people make decisions about their health benefits, and they provide end-to-end transactional services in terms of how, basically turnkey services to help employers and employees alike. They can be single carrier exchanges or multi-carrier exchanges. They could be single employer exchanges or multi-employer exchanges, and they could also provide other benefits such as dental, vision, and voluntary benefits that you may not think about too often, like life, short-term and long-term disability, and even things like legal benefits and pet insurance, and there are others to go along with that as well. It's a pretty crowded field, and I don't think that this slide even does it justice, but just to give you a sense of some of the names out there, it reminds me of the years leading up to 2001 when we had health reimbursement arrangements. And for those of you that were, studying health benefits back then, you may remember companies like Definity Health and Luminos that eventually got acquired, and some others that went out of business that aren't around anymore. And we'll see, which of these on the slide, and I think there's another slide from one of the other speakers that has others listed as well. We'll see who will be around and who gets acquired and who basically is able to maintain the business model that they develop. How fast will a movement to private exchanges happen? I'll go out on a limb and basically say that it's tough to say. I've seen estimates that as much as 10% of the employment-based market will be in a private exchange come 2020. The best I could do is tell you how fast other trends and benefits happened. For example, the movement to defined contribution retirement plans, which is what's shown in the slide. It's the red line. Played out over the better part of 30 years. It took from 1979 to 2010 to go from 15% of workers with a defined contribution plan only to 70%. Didn't happen overnight. Similarly, with retiree health benefits, the percentage of employers offering those benefits has been falling. It was as high as, for employers with 500 or more workers, as high as 46% back in 1993, and it took the better part of 20 years to get down to 24%. So again, it didn't happen overnight, but it happened. And you saw this slide already, the movement to consumer-driven health plans. After a decade, we're only at 19%. So maybe after 10 years from now, we'll be at 20% of workers in some type of private exchange. But it's a really tough number to project, given that there aren't that many out there live, and employers have a lot of interest, but most don't want to be first. And employers do, even though I said before, most don't want to be first or third. It takes quite a while for employers to follow the lead of when there's I guess a herd mentality. So I think that's the end of my slides, and I look forward to the Q&A.
Thanks, Paul, for that update on the current state of employee health benefits and the move to defined contribution and the potential for it to create more predictable health care costs. To delve in more deeply on private exchanges and other future models of health benefits, we will now hear from Howard Lapsley, a partner in Oliver Wyman's Health and Life Sciences practice. Howard?
Thank you, Catherine, and thank you, Paul, for that lead-in. What I'm going to spend the next 20 minutes or so discussing is our take on some of the new supplier and distribution dynamics that are taking shape in the employer-sponsored benefits marketplace, specifically around the growth and the different types of private exchanges, and also some of the changing nature of providers both as collaborators and competitors, real co-opetition, if you will, in and around exchanges and also direct to employers. So I'll spend a couple of minutes focusing on that towards the end. But if you think about private exchanges and new provider models, they're important components of a broader shift into what we call Retail 2.0. And Retail 2.0 is characterized by not only channel proliferation, but also other important components like convenience and access. For example, one high-profile health plan CEO says, convenience is the new quality. And it's, think about individuals and the retail marketplace and how they care and how they're concerned about both convenience in terms of how they experience the system, but convenience in terms of how they access and learn about the system. You're seeing a huge range of different models and market examples that are out there that are appealing to different segments. Same with engagement and rewards. How do we think about new ways of incentives and reward programs and using peer-to-peer networks and information gathering that are really going to change the dynamic of the retail world. And then value, as prices become more transparency and more responsibilities on the employee, where do they really make those value choices? And what does that mean in terms of how you design products and think about tools that help those consumers make those decisions, whether they're on their own, in the individual market, or as employees as part of an employer-based offering. And then we mentioned channel multiplication, of which we'll talk specifically about private exchanges, but there are all kinds of other models of channel multiplication proliferation that are occurring in the marketplace today as well. So Paul explained what a private exchange was, but why private exchanges and why now? Why do we think that we're at the inflection point for our adoption of that model? Well, a couple of things in terms of, on the left-hand side of the slide here, in terms of some of the drivers for employers, benefits that are continuing to outpace inflation, new ACA regulations and compliance requirements, other pressures to reduce costs and the numbers of resources in human capital departments, workforces that are mobile and multi-state, and then a real need for a differentiated employee value proposition in a marketplace that is, in certain sectors, very, very competitive still. For employees, as they have increased responsibility, increased transparency and choice, be able to navigate and have some guided choice in what that in what those offerings are, and an ever-increasing number of channels and offerings that are out there. And really being able to, have a mobile and social shopping experience that becomes the norm as opposed to becoming what has been dictated to you by your employer. And so private exchanges really can provide that integrated turnkey solutions that addresses those challenges, from the ability to support defined contribution, and Paul mentioned kind of the willingness to go into defined contribution models. We'll talk a little bit more about that in a subsequent slide. The ability to have one-stop shop administration and compliance services that can reduce HR staff and time required, resources. It could be a single national platform. You can have a wide range of benefits and different plans and different benefit solutions that can be offered with clear, standardized information and transparency around each one. And it really starts to resemble and map to a 21st century shopping experience where you know what you're buying, you can understand what you're buying, there's price transparency around that, there's ability to be able to compare and be able to discuss that with your peers and understand that. And private exchanges, as well as other more advanced electronic marketplaces, enable that to occur. Paul mentioned a couple of surveys. What's interesting, and this is some data from surveys that we've conducted, and we probably all of us on this call today have seen multiple different published employer-employee surveys and published opinion pieces from payers, et cetera. But what we see, and we go out and we actively survey every couple of months or so, and what we've seen over the last 18 months, both in our research as well as other third-party published research, is a clear trend. And that clear trend is an ever-increasing understanding of what private exchanges are, ever-increasing attractiveness to what private exchanges are, and ever-increasing intent to moving to in one form or another, to a private exchange environment. And so whether the key question is how, and Paul mentioned this, is how fast will the adoption curve be, or how steep will the adoption curve be? One thing is sure, that we believe the defined contribution model and private exchanges in their broad definition are here and are here to stay. And we think that the confidence from employers in their ability to be able to have a successful employee offering through a private exchange is increasing rapidly. And I'll show you in a second what our viewpoint is on where we see the market by 2018, sort of 5 years from now in terms of adoption. What would some of the things be that would help to impact this adoption curve? It could be anything from, what is that acceptance of going from conversion from defined benefits to defined contribution, much as it did, as Paul mentioned, in the retirement. Is it going to be quicker, or is it going to be slower adoption curve? I think there's a lot of, we feel strong evidence that believes that adoption curve is going to be more rapid, just because of the economics and the pressures around that. We believe one other impact, especially in the small groups side, is how well will shop exchanges be adopted, as shop exchange certainly represents a competitor to private exchanges in the small group market, and then increasingly into the middle market as the years go on. What kind of coverage will uninsured individuals actually seek out? So how will the penalties and the subsidies provided by the ACA increase the size of the individual segment? And will the vast majority of uninsured individuals who are subsidy eligible in 2014, how much of them will drive purchase and do so on public exchanges, which would limit the opportunity for private exchanges to gain in these particular areas? And then overall public exchange adoption. So there are a number of different trends at work in terms of impacting the overall growth and adoption of private exchanges. But in one sense, what is that tipping point going to occur? And again, from our research that we've been conducting, looking at the economics that are associated with it, looking at both employee needs as well as employer needs, we see that interest and that level of desire and adoption increasing, and so we're fairly bullish on that. And so if you take a look at the next slide, this is what our modeling that we've developed based on those surveys and other economic analysis has. It says by 2018, we believe that over 60 million lives will be on the public and private exchanges. And so if you look at this chart from left to right, each one of these segments is a total number of each one of these groups, and then the color coding is whether they be off exchange, i.e. in the traditional status quo, be on a private exchange, be on a public exchange, or with public employers and Medicaid. We haven't dove into that sector, but certainly, as you can see, the vast majority of individual lives, because the vast majority of individual lives will be come 2014 will be eligible for subsidies, will buy on the exchanges. Those go through public exchanges, and then we've modeled out what the size would be for the large commercial mid-market, et cetera. So that's roughly 20% of the total market through some kind of form of exchange by 2018. So it's a fairly bullish perspective. Again, if you talk to both the growth of exchanges, and I'll get into that in a second, but their level of interest that they're seeing from employers, both from the Aon Hewitts at the upper end of the employer size to the regional and mid-market private exchanges that are taking place, they certainly would agree with that adoption curve. In terms of exchange models, we've categorized them into 5 different initial private exchange participation models that go in a spectrum from being much more carrier-centric, i.e. a proprietary carrier platform where it is the carrier that has a technology back end to it, all the way down to the bottom, which is really the exchange owning the customer relationship. And so the big ones are this notion of a carrier-owned, single carrier-owned exchange that has a technology backbone that's delivered by a provider to the same basic flavor but more co-branded with that back-end provider. C is a third-party exchange relationship that's exclusive. So that's why those 3, A, B, and C, are grouped together. They're all different flavors of basically a single carrier exchange. D is the classic third-party, Travelocity-like open marketplace with multiple carrier choices, whether there'll be multiple carriers for that can be chosen within a single employer, like an Aon Hewitt model that has risk adjustment, or whether there'll be multiple carriers offered, but the employer has to choose. Ultimately, when they choose, they have to choose only one carrier. To the network rental example, where Buck is saying we'll rent a provider network, and then go out directly to the employer on an ASO basis and design the product and have a card like that. So those are the ranges of them, from being very much a carrier, single proprietary carrier platform with all the technology underneath it that's white labeled, if you will, to being the more kind of radical end of the spectrum with like what Buck Consultants is doing right now, to probably what most of us in the large end of the employer marketplace are seeing and hearing, the Ken Sperlings of the Aon Hewitts. And if you flip to the next slide here, we've charted out the exchange marketplace, the private exchange marketplace as we see it today. And obviously this is a constantly moving picture and shifting, but we count up to over 30 exchanges and 10 major technology providers that have been announced to date. And as Paul says, undoubtedly there's going to be a ton of consolidation and movement and bankruptcies and buyouts, et cetera, along the dimensions. But this is how we've mapped and categorized them across the defined benefit, defined contribution, employer size, to those five sets that we talked about on the prior slide. Now, it's a very crowded marketplace, and it'll be interesting to see how that shakes out, specifically at the middle market level and the regional level. You've probably all heard about some high-profile examples, Sears and Darden. Sears going from one plan choice to 15 plans, or 4 to 15, and Darden as well. There's some high-profile examples of some major employers that are in the defined contribution model. And I guess from what we've been learning from early results of this, what's interesting is that 25% of folks that are signing up for plans in a defined contribution model are choosing plans that are richer, interestingly, in benefits, and but 42%, according to early returns, are choosing plans that are leaner. And so what's interesting is that this is an indication that real employee transparency and the notion of the two-step sale between the business-to-business and business-to-business-to-consumer, B2B2C, is a very important notion for payers going forward in terms of their design of the products that they both offer through a proprietary private exchange or through a third-party private exchange. And that employee transparency, that employee freedom to use their defined contribution dollar, it's really up to that individual. And that's why it truly is a segmentation game. Not everyone, we see probably some earlier surveys that were released that said there was high dissatisfaction with employee-based benefit offerings, and 90% would choose a plan that was probably leaner. Once they truly have choice, and once they truly see their dollar, and once they truly understand the value of what they're buying, you get typical segmented behavior. Well, some will stay the same, some will buy up, and in this case, 42% buy down. And so Paul mentioned the DB to DC retirement transition. Will this be more rapid to that? Will it be rapid like the CDHP, doubling in 5 years and up to 20%? That again, time will tell. But we believe that it is here, that it is going to be more and more active, and people are going to adopt more and more quickly over the next couple of years, so that you see the model results that we have by 2018. So let me switch gears now and talk about the second part of the supplier distribution dynamics. And this is really the role of providers in the marketplace going forward in terms of offering benefits through exchanges or even direct to employers, and how that dynamic is going to help shift, in some places have fairly high disruption in the competitive landscape and how benefits are offered or chosen. First, if we think about a provider as a collaborator, both payers and providers are focusing and have focused for some time now on finding ways to deliver better care at more affordable prices. And both sides of that spectrum, payers and providers, understand that there's a capability gap that's not easily filled by either side. And so what we've been seeing over the past few years is a growth in new kinds of collaboration between payers and providers to help fill the gap. Each part taking on some new roles and responsibilities. And we also seen some fairly extreme blurring of the lines as payers enter care delivery actively, or providers that take on risk, like a Cornerstone, for example. And so that although not all providers will be in a position to or want to take on risk or compete for employer business, it's certainly a market reality worth taking seriously. And then if we think about providers as competitors, in the near term, providers may be advantaged over plans in their ability to actually reduce costs and pass those savings on to employers, or through exchanges, public exchanges, pass those savings on to individuals. And we think that providers are as well or better positioned and certainly more nimble potentially than some payers to reduce costs via development of narrow networks. Can they go further and faster than some of their payer competitors? Potentially. Can they go further in terms of reducing leakage by changing physician comp systems more quickly? Potentially, yes. And they're certainly potentially advantaged over payers in their ability to coordinate care. So it is interesting to think of them as a competitor in the near term, being able to pull those levers, both either as collaborators or competitors, and to the extent to which they can pull those levers more quickly and be more nimble around that. And then if we think about other forms of employer providers and competing with plans for employer business using new models, there are a number of potential models out there and exemplars. As providers compete for employer business, we think the majority will fall in kind of the first category here, which is competitors like IDSs with multiple facilities and own physicians, or large independent physicians groups, typically beginning with a product such as MA off the exchange, or migrating small groups and large employer segments as they get more sophisticated. So they look to take on risk for a particular total population where they'll cap with the employer's financial exposure will cap. Other business models might be where on a retail care delivery, whether providers offer a retail front end whereby employers buy the access to convenient care options as a layer in front of the traditional primary care physician as a mechanism to keep costs down. You see that with HEB and Ready Clinic in Texas. Or another potential option is the specialty carve-out, where providers with deep expertise in managing the cost of complex members like cancer patients or end-stage renal disease may approach employers to seek to carve this out and take on the full risk of this management, i.e. directly from the provider to the employer. So, all three of these different flavors will emerge, or could emerge, probably more on the left than the right. But as we think about the shifting dynamics in the marketplace and the role that providers will play both on the exchange and around the exchange, and then direct to employer as population health managers, it's a different and interesting dynamic to consider as you consider the whole shifting and growth of the retail market and the changing role that consumers will want to play, and therefore the changing role that employers will play in terms of who their suppliers are, who their customers are, and how the choices and value that they offer to their employees. So to wrap up my section here, private exchanges aren't a fad. They're going to be a key component of the future employer benefits marketplace. They certainly don't look alike. There are different geographic focuses, different target employers, different value propositions, different ranges of services, different value-added capabilities. And so as a payer focusing on how to think about them, they really represent the ultimate co-opetition. They are going to control, and the size of the market is going to go through them. And so how you play on them and who you align with and who you target with, it really matters. And it really matters in terms of how you think about your book of business today and how your book of business will look in the future, and what your product portfolio is going to do to map to both all elements of your distribution portfolio, including the different types of private exchanges that you're going to want to do business with in order to continue to have appeal to those segments of your book of business that you want to. And so they represent really a comprehensive retail product and distribution strategy. Private exchanges are just one component of that. And as we just talked about, new entrants and partnerships are going to emerge as meaningful exchange competitors, private exchange, public exchange, and direct-to-employer models too. And the local dynamics, as we all know, are incredibly important here, both in terms of how different they are from market to market and competitive environment, but how important they are to understand them to be able to position yourselves effectively to compete. So that's my section, Catherine.
Great. Thanks, Howard, for sharing those strategies and models for insurers and employers to consider going forward. Our final speaker is going to share some specific examples of how a health insurer is helping employers make benefit decisions under healthcare reform. And we're now joined by Bill Brown, Manager of Digital Distribution at Highmark Blue Cross Blue Shield. Bill is responsible for strategy, development, and delivery of Highmark's private exchange for Pennsylvania, West Virginia, and Delaware. Bill?
Thanks, Catherine. And I want to say, Paul and Howard, you guys did a great job with throwing out statistics and actual marketplace impacts. And I think some of the things that I'm going to touch on definitely talk about the marketplace and the impacts for the employer. But what I'm specifically going to touch on is a few tools that Highmark has put out into the market to really get employers to where they need to be or understand the impacts of where they need to go as we get closer to 2014. So the tools that I'm going to talk about specifically are Healthcare Reform Planner Tool and My Benefits Private Exchange. The private exchange is a single carrier platform that Highmark has created, and our Healthcare Reform Planner Tool is a tool that Highmark also created internally that will assist some of the employers to make decisions, more scenario planning type decisions. So I'm going to first start with the Healthcare Reform Planner Tool. And you can see on the screen there are two pieces to this tool. On the left side of the page, it says understand the facts. Inside that is it's actually a video that talks about the impacts for employers under the Affordable Care Act. What changes, what things will directly impact those employers. And then on the right side is the simulator. And the simulator is what I'm going to focus more on today. I'm going to show you a few screenshots of what the simulator looks like and how that can help an employer make some decisions moving forward. So the first scenario I'm going to show here is just a really generic example of left side of the screen is a employer-sponsored plan current, and right side of the screen is what an employer exact plan that they were in 2012 might look like in 2014, and we're just looking at it from contribution standpoint. And you can see on the left side you have an annual cost of $1 million, and then on the right side, just with traditional increase of rates and market trends, you see that that same plan going from one year to the next is $1.1 million. So you have just an initial impact on an everyday traditional rate increase. On the bottom of the screen, you can see that there are other factors down here. It shows that average cost for an employee might have been $800, and then those increases of rates and market trends may push that to, on the right side, you'll see it was $882. So these are just examples of the small increases that will have big impacts to the overall for some employer-sponsored coverage. So the next example that I have here, this shows some real-time modifications. This tool has the ability to actually show how the cost shifting will impact employees. You can see the two red squares at the bottom of the page. On the left-hand side, that is their traditional coverage, the same that you saw on the first slide. But then on the right-hand side, it's showing the impact if the employer would lower their contribution amount. So you can see on the left-hand side, it's a 70-30 employer to employee split, but on the right side, that they changed that to a 55-45 split. And the contribution amount for the employer changes, but it then also shows on the right side of the screen what the employee cost is going to do. It's going to raise the employee cost, and in some cases, 3.6% for an employee, and that's a significant increase in most cases for an employee. In most cases, it's larger than what their pay increase was just over a regular inflation rate. So this is a really easy scenario to look at and really see the big difference in the shift if employers do start shifting some of that responsibility to the employees and those easy impacts that will come from that. And the last example that I have here is this one is basically dropping coverage altogether, and what impact does that have for that employee? So left side, again, it's that current plan basically saying 2014, this is if you stayed in that same plan. And on the right side, showing this is the impact if you would drop your coverage and let your folks go to the retail marketplace. It actually increases cost for this example. It shows that there are $324,000 in penalties and $1.2 million to make those employees whole. And those are some of the impacts that people aren't realizing until they see a tool like this, or they have a consultant come in and talk them through the penalties and the impacts, what that means to payroll and things like that for them. And it's an easy thing to just say, I want to drop coverage, because they believe that it's going to be best for them. But there are a lot of hidden penalties and a lot of hidden fees that they aren't accounting for. On the right side of this page, you can see it also shows these are the side effects of dropping coverage and what it will happen. It impacts productivity, recruiting and retention, and the perception of that employer in general. So there are other things that are impacting that employer, not just the fact that they could save or just get out of medical benefits at all. It gives them a real life example of these are the things that you're going to see in the impacts that this is going to cause. So the last slide on the Reform Planner tool is a summary report. So what this basically does is after you would sit down with an employer and go through those scenarios those few pages that we went through. You have the ability to then download this into a nice PDF brochure for that employer to take back. You can email this back to the employer. Basically, put in there the information, the facts from the very first page. You can download that and print that on into this packet. And also, it puts those scenarios in a generic overview at first, which is what this page shows, and then behind that detailed scenarios, basically screen prints with descriptions behind it from those slides previously. One of the other things that this tool does is where you could change that funding arrangement. You could also switch that funding arrangement from a defined benefit to a defined contribution. So that way the employer would be able to see what the impacts to their bottom line would be if they did flatten out their rates or flatten out their premium contribution and go the path of a private exchange. So the next tool I'm going to talk to is the My Benefits Private Exchange. This is the private exchange solution that Highmark put in place. We've actually had this in place for about 18 months. So wanted to just give a generic, this is a screenshot of what the homepage looks like, and this is a real live active platform. There are a lot of players in the market and a lot of capabilities that you have to look into when you're looking into this space. And at Highmark, we did a very intense, about 6-month review of all the capabilities and all the players in the market. And as we continue down the path with our chosen vendor, we still continue to do these assessments to make sure that the market hasn't changed to a point where we have to bring in another partner or look out and maybe go out and talk to a Aon or a Mercer or a Willis to hit a different market segment. I think Howard and Paul, they were really hitting it on the head, saying that you may not have one solution to hit all of your markets. There may be different solutions as you go across different markets. And one of the things I want to call out in this slide specifically is private exchanges are not cookie cutter. There are many different things that exchanges do. For the most part, the things that everyone sees and everyone talks about is the shopping portion of those exchanges. That is where most of these private exchanges live. They have a really robust shopping experience to capture that that consumer when they come into the platform. They get through a shopping experience, and then the carrier or whomever is responsible for doing the portions after the fact. The thing that you really want to take into account, or any carrier such as Highmark has taken into account, is what are the capabilities that we need and that we're looking for. And there's really not a solution that is the overall right solution for everyone in the market. There are needs that each carrier would have, and this slide is a really generic example of what those are. So shopping, enrollment, employee self-service, billing, payroll. Do you want to do defined contribution accounting? Do you want to do self-funding accounting? And then one of the most important pieces is the administration for the employer. So my next slide shows similar to where Howard's slide was, with where these vendors are across the market, who's more carrier focused towards who has the capabilities that are from a basic shopping experience to a more comprehensive end-to-end solution. And as I said earlier, there's no best in class. It just depends in general what someone would be looking for. So if there was just a shopping only that a carrier or an employer would be interested in, there are a lot of options in that space. As you get towards the right side of the capability chart here, you see that there are options that are a little bit more than shopping, and there are some that are a name that I always like to throw out there, Benefit Focus. Blues plans have been using Benefit Focus for years for enrollment. Benefit Focus this year came out with a marketplace, so now they have a shopping and enrollment tool. So these platforms are evolving as we speak. So tomorrow, in my slide, I may have to grab one of these names and move it further right or move it further up. But I think Howard touched on that also with his slide with the grids, the grid of where these vendors are and what they're doing. Those slides will change constantly. These vendors are evolving. They're combining. They're being bought out, and it's a really interesting market. And it's actually an exciting time for healthcare in my eyes. So I want to talk about specifically the opportunity that Highmark sees in this marketplace and what we've done. And basically, for our My Benefits platform, we partnered with Array Health. They're a software vendor from Seattle, Washington. If we go back to the slide prior to this, they're in the upper right quadrant. This is what Highmark was looking for. We were looking for something that was an end-to-end solution, and we wanted them to be truly carrier-focused. Our platform is single carrier only. It's all Blue products on our platform, and we offer medical, dental, vision, critical illness, and accident policies on our platform. We're also doing surveys and doing market research constantly to find out what are other products that folks want on this platform or they're asking for. And I kind of get a chuckle out of it all the time, but the number one thing that people want to see is pet insurance. And Highmark's kicked around pet insurance for a long time, and this is definitely a time and place that we can throw a pet product out onto this platform and get it exposure into the market where these consumers really want to see it. The other thing that I want to touch on is there are vendors that are focused on defined contribution, and then there are some that are focused on fully insured. Our platform does both. We could satisfy a fully insured group or a self-insured group, and also the platform accommodates any group size. When we first got into the space, we thought the sweet spot of this private exchange market would be the smaller groups under 50. But what we're seeing is the under 50s are interested, but the bigger groups are more interested and are moving faster. They see the savings in large scale that they can have from a defined contribution, and they also see the opportunity of the ease of administration on a platform such as ours. And one last thing I want to talk about before we turn it over for some Q&A is some of the big high-level learnings that we've seen as Highmark as of the rollout of our private exchange. So number one is the education of employers to the advantage of a private exchange. It's new, it's shiny, it's technology. A lot of folks are afraid of it. This is the evolution of healthcare in my eyes. So I feel like we're on the cutting edge of where things are going, and I believe in a few years people will look back and say, oh, you buy your products that way. Everyone else is doing this electronically through exchanges or through retail platforms at carriers and things like that. I think this shift is going to happen fast and furious, and we're strapping on our seatbelt right now. We've seen, for the most part, all of the groups that we've transitioned from a traditional plan to a private exchange, they're very comfortable with, after the first few enrollments, that they're very comfortable with going back in, checking out their plan options, seeing what else, what other opportunities there might be for them. This is truly like an Amazon.com type of environment we're getting into with our healthcare. And people are very comfortable already out on the internet searching and shopping, and this is just the next step for that shopping moving into healthcare. I mentioned that we thought smaller groups would be more interested faster, but we're seeing that trend is getting into larger groups a lot faster. Small groups are definitely interested, but the larger groups are definitely are moving that space fast. The most common feedback we've gotten from surveys is that employees like to have all of these ancillary products and all of these options in front of them. right now. And in most cases, they haven't had the opportunity to have all of those different products in front of them in one sitting. So now they actually have that opportunity to select their medical, their dental, their vision, their critical illness and accident policy right there all together and seamless. So the one last point, I don't have detail on this, but it's interesting for the employee purchasing, and this was a really like an eye-opener for us as we get into public exchanges and we get into all these other private exchange types of how are people going to purchase and what are they going to purchase. And I think the easiest way to explain it is there's really no rhyme or reason to what we've seen. We have over 6,000 members that have gone through enrollment on the platform, and the trends are if people are picking higher deductible plans, they're coupling them with critical illness and accident policies. But for the most part, when that's happening, it's kind of a crapshoot. Sometimes it happens in blue-collar world. Sometimes it happens in law firms. So the shift in the purchasing is really the easiest way for me to explain it is how do people feel that day, and when they go out to purchase is really how they're going out there and buying these products. It's a really interesting trend. The one great thing that I've seen with our platform is that enrollment from start to finish usually takes around 10 to 15 minutes tops, and there's a lot of information that people are digesting in a short period of time, and I guess I lean on the fact that people are now shopping so much online and they're so used to this that they're okay with their health insurance being out there on their mobile phone or on a tablet, or when they're sitting on their patio, that they can go out and shop for their coverage, not sitting in their at their desk or having an HR person sit with them and go through these things. I think it's a really interesting shift, and I'm definitely interested to seeing how the next 12 to 18 months goes for the industry. So that's all I have. So we're going to go into some Q&A, I think, and I thank you again for giving me the opportunity to speak.
Great. Thanks so much, Bill, for sharing Highmark's commitment to helping employers and consumers make informed decisions about health benefits going forward. And I just want to quickly apologize. I know we had some technical difficulties at the beginning with people trying to hear the audio over the computer, so we're very sorry for that. We do have the slides up on our website, and we're going to check on the audio recording. We might not have it for the entire first few minutes, but we'll definitely get what we can up on the website for you all. I do want to ask our operator to come on now to explain how you can ask a question over the phone. Tracy?
Thank you. If you would like to ask a question, please signal by pressing the star key followed by the digit 1 on your telephone keypad. If you are using a speakerphone, please make sure your mute function is turned off to allow your signal to reach our equipment. If you have signaled for a question prior to hearing these instructions on today's call, please repeat the process now by pressing star 1 again to ensure our equipment has captured your signal. We'll pause for just a moment to allow everyone an opportunity to signal for questions. Please go ahead, Ms. Santoro.
Great, thank you. Bill, I had just one or two clarifying questions that came through for you. The employer tool is something just for Highmark's employer groups to access, correct?
Yes, that's correct. For now, we're actually assisting the employers with their current plan into a future state plan, and the initial rollout was for Highmark groups only, but we are working with some brokers to get the tool out there for groups that may not be Highmark groups.
Okay, great. And could you also, this is a broader question for everyone, but maybe you could touch on it first. We had a question come in about what you see as the implications of the anticipated changes ahead on worksite wellness programs. I don't know if you could speak to how you see that happening on the private exchange for Highmark.
Yeah, so we believe that wellness programs and wellness in general they're actually going to take over the market. We think that they're always going to be packaged with some of the larger groups that we see as an employer shifts to the private exchange. They may say we're also going to do these wellness activities and tie contribution amounts to wellness activities. So doing things that are preventative exams, or doing some blood tests, or following your if you're a diabetic and you go in and do your checkups regularly, that the contribution amounts that employers are going to offer may be impacted by those wellness activities.
Howard or Paul, do you have anything to add?
Yeah, this is Paul. I would add that one of the things, there's this myth that private exchanges mean that employers are getting out of the business of offering health benefits. They're not when they move to a private exchange, much like when employers move from defined benefit to defined contribution retirement plans. They didn't stop offering retirement plans. They just sort of redefined their role and the type of plan that was offered. And I think that as employers move to private exchanges, they still want to see costs be under control. That's one of the main goals of moving to a private exchange. And as a result, the workplace wellness programs will have an increasing role to play, especially with this 2018 excise tax on high-cost health plans looming out there. I think employers are going, and that may be one of the reasons why private exchanges take off faster than other things have taken off. There's a whole lot more urgency in terms of 2018 and the excise tax.
Yeah, this is Howard. I agree with what Paul said. I think that these private exchanges are actually a way for employers to have a win-win, where they can have more control over costs, more predictability over costs, and yet still play a very active role in designing the benefits for their employees and working with a whole new slew of access points to provide those employees the benefits that are best suited for them. So it's a real win-win for them. I know that in the larger platforms, wellness is not a defined standalone packaged offering, even though there's been some employer demand for that. So it is going to be interesting to see how quickly that evolves as offerings on a wide variety of exchanges.
Great. Tracy, do we have any questions yet?
Yes, our first question comes from Fern Schinbaum. Please go ahead.
I had a question for the gentleman from Highmark. I'm in a state that y'all don't serve, but we are served by Blue Cross Blue Shield of Alabama. And I was wondering, do they have the tools that you have, or can I get your tools just to look at them?
Yeah, so we currently aren't in Alabama, obviously, but I think we do have some relationships with folks at Blue Cross Alabama. So there may be opportunity if there are groups interested in a tool like ours. What I would suggest is talk to your sales reps and have them get in touch through their regular means to Highmark, so then we can have some conversations offline.
Okay, thank you.
Yes.
Thank you. Ladies and gentlemen on the telephone, as a reminder, if you would like to ask a question, please press *1 on your touch-tone phone. And our next question comes from Ken Smith. Please go ahead.
Sorry, I think it's Keith Smith. I have a question about the role of the agent or broker with the exchanges. If the revenue, such as commission-based revenue, is still the model, or if that has changed to a fee or PEPM in addition to commissions, or if there's any thought on that. Thank you.
This is Howard. I would say that what we are seeing is a range of all of that. You're certainly seeing the death of the broker is certainly over-exaggerated. There's in the individual marketplace, that broker will, some of them will diminished role, but in the small group and middle market and large group space, broker consultant will play a different role in some cases than the traditional role, and there will be a different revenue model associated with that. And we see both of the models that you mentioned as potentials for that. It's going to depend on the structure that the exchange sets up and the structure that the payer and the broker set up on top of that exchange.
And this is Bill. I agree 100% with that. I think each exchange is going to have its own reimbursement model for those brokers. The brokers, at least in our world, in the Highmark footprint, they're a big part of keeping our groups together, and there's no I guess no point in time where we see them going away. We actually have strong relationships with those brokers, and they have strong relationships with the employers. So I think the model that is specific to a private exchange, where there are some that are per member and there are some that are still percent commission based, they're all going to exist, and the brokers will find a way to survive. And if it's partnering with a carrier such as Highmark or going out and creating an exchange of their own, I see that both of those scenarios happening.
Great. Thank you, Tracy. Are there any more questions?
Thank you. There are no further questions at this time. Please go ahead.
Okay. We still have time for the Q&A, so please continue to call in if you have questions. We have a few that were submitted online and in advance of the event, so we'll go to those right now. The first question is, what do you see as the future for CDHPs? Have ACA regulations regarding treatment of employer HSA contributions, ability to exceed max deductible levels if needed to achieve a given metal level, plus or minus 2% margin around actuarial value levels, taking care of concerns that CDHPs would have to be limited under the ACA?
Catherine, this is Paul. I'll take a shot at it. That's a mouthful question. I think that CDHPs will play a role in private exchanges. They'll be one of the options. And the fact that the employer contributions count towards actuarial value is going to make them more attractive. I'll raise the point again about the excise tax on high-cost health plans. With employers so interested in avoiding the tax, you may see some acceleration and adoption of CDHPs, though I think they'll play a role in the private exchanges. So to the degree that employers move to private exchanges, people have the option themselves of choosing it if that's something they want.
Okay. Howard or Bill, any thoughts on that question? Okay, we'll move on to some other questions submitted online. And Howard, you touched on a few of these models. We had a participant ask about whether creative employer-based models such as on-site clinics or direct primary care will take root, and if so, will it drive down costs for employers, and will it count as a type of insurance to sidestep the excise or Cadillac tax? You touched on this a bit, but
yeah. So I think it's a really exciting time for employees and employers to think about all the different models that are going to be out there for them to receive care that are so much different from the traditional, Monday through Friday, 9 to 5 doctor's offices that are there. I can't comment on the although I can't comment on to the regulatory aspects of it or the tax aspects of it vis-a-vis the Cadillac tax, but I'm assuming that if we were thinking about fundamentally different ways that care is going to be delivered, that is focused on the consumer of the health care, and as one of the examples I had of the retail clinics that are the places of convenience for consumers to go. It's where they get their toothpaste. It's where they fill their prescriptions. And if they can have the clinical services there that they desire, and that's tied into wellness programs and seminars that are there that the employer is sponsoring and the employer is paid into, or it's tied into caregiving services that they have that the employer is paying into. Just the ability of that employer and that employee to make their lives easier and have access at times outside of work that increases that employee's productivity. You're going to see a whole burst and proliferation of these kinds of models that are out there, and it'll change the nature about how care is received and delivered and experienced. And the employer is going to be at the forefront of that because that at the end is going to enable their employees to be more productive. And in terms of the cost savings, the cost savings are there because if you have efficient coordinated care throughout the system where people are playing up to their licenses, so you have the physician's assistants and the nurse practitioners that are in the clinical settings that are doing the maximum they can do to their license, and you have the right kinds of systems and coordination that enable the docs to focus on those things that they went to medical school for, then that's going to make the system efficient. There's a lot of work to go to get there. We see bits and pieces of this model taking place, and it's going to be a long road, but that's the future, we believe.
Great, thanks. Bill or Paul, anything to add?
Mm-hmm.
Yes, so this is Bill, and as some of you might know, we've recently invested ourselves into the hospital side of the world, not just the carrier side. And I think one of the things that our company will be focused on when we are in that provider space is really keeping the care in the communities and focusing on the consumers themselves, not just farming them through our hospital factories. It's more so centered on keeping people where they are and where they're comfortable. And we have a lot of outpatient clinics, and we have a lot of community hospitals that we want to make sure that the care stays there, keeps those communities growing, keeps those community assets strong. So I think that's you'll see that happening. I mean, in our service area especially, but I think across the country, you're going to see a lot more of the carriers really focused on consumers. And I mean, we have a really robust consumer experience department here, and basically just bending the trends that we've been on for so long to really focus on that consumer, one consumer at a time, and really make sure we're focusing on their wants and needs and not just the big picture.
Great. Thanks, Bill. I guess teeing off of that on the consumer experience, could you, elaborate a little bit about what your experience has been in your 3 states so far, working with consumers and kind of transitioning to sort of the online Amazon-like marketplace? And I know you also operate retail stores in Pennsylvania, and kind of the in-person versus online experience and any consumer feedback.
Yeah, so we actually have tried to make great strides over the past few years with consumer experience in general. And I think the private exchange gives consumers another step towards really controlling their fate. So they, prior to a platform such as our My Benefits platform, their employer may have just said, this is your medical option and this is the direction you get to go, opt in or opt out. Now they're having the opportunity to really look at plan options, what's best for their family, what's best for them at that time, and how to couple that with some of the other products that are available. Example, like I said earlier, is high deductible plans are a lot more affordable, but then people are worried about high deductibles. So we give the opportunity for an accident or a critical illness policy to be attached at really, really minuscule prices. That if there is an accident that occurs, and that policy will kick in and be able to help those members cover their deductibles. So we're really focused on trying to do the right thing for the consumer. We've also, when we're in the provider space now, we've also created a group that will revamp our patient experience. So really, there's a lot of fragmentation that happens when you go from hospital to hospital or clinic to clinic. So there's going to be great strides that are going to happen here through our network to just basically take some of that pain away from the employees, from our members, to get them to a more streamlined process of care.
We had another question come in. It gets back to maybe just some clarification about some of the coverage requirements of the ACA and some confusion that people have about the public versus private exchanges that maybe you all can help us with. The person is asking, do plans offered on the private exchange have to meet coverage requirements of the ACA, actuarial equivalents, and can they offer sort of these low-cost, bare-bones, skinny plans that have been in the media recently?
So I guess I'll answer that one. This is Bill. I think our take on it is all the plans that are on our private exchange are qualified health plans, so they have all the essential benefits that are necessary. What we do have on our platform is we have a low-cost option that is normally a high-deductible option, and then we also have richer benefit plans that are basically that's the spread for those members. They get to see what is the lowest cost option that basically covers my employer for ACA purposes. So it does cover the percentage needed, and the contributions that the employer gives cover the percentage needed to make that a qualified plan. And then there are also options out there on our platform that are basically buy-up options. So you might not want that low-cost option, but there are options that are similar to that have different deductible levels or richer benefit designs. So our platform has a basic scale that you have a good enough spread between 5 medical options that you could pick a plan that even the lowest cost is still covering you for essential benefits.
Bill, this is Paul. How do you deal with adverse selection?
That's a great question. So right now we're basically still in, I guess, gathering mode. So we're gathering information based on how employees are selecting. So far it's not been as treacherous as every actuary on the planet would think it's been, or think it should be. It's been pretty average to where the members that were in richer plans before are staying in richer plans, and the members that may not have had a coverage before because they didn't have the option, now they're coming onto the platform. They're not all selecting the cheapest plan, and the sick people aren't all selecting the richest plan. So I know every actuary has nightmares about what does this consumer-friendly world turn into, but as far as we've seen so far, there hasn't been any huge gaps or peaks or valleys that are saying, wow, we better pull this plan off because it's really murdering us on the carrier side. I think the spreads and the risk that we have is pretty much where it was even in the traditional model.
Thanks.
Great. Tracy, any last questions over the phone?
There are no questions from the phone lines at this time.
Okay. Maybe one final question so that we can end on time and ask kind of our speakers' perspectives. We've talked a lot about some of the initial reforms and the excise or Cadillac tax, and Howard touched on some potential what happens with the shop exchanges might impact the future of private exchanges and employer-sponsored insurance. So we're curious kind of your perspectives on what future provisions you see significantly impacting the market. There's a few examples thrown out if exchanges are open to larger business in future years, the excise tax, among others.
This is Paul. We don't have a whole lot of time, so I'll just throw out one, which is rules regarding discrimination in fully insured plans. We still haven't seen them, and I think that that may impact where employers go depending upon how those rules come out.
Howard or Bill, any thoughts? Okay, well, I'll wrap up our event today. Thank our panel of speakers for joining us today to share their expertise and insights. We do have copies of the slides on our website, and an archive will be made available shortly. We are interested in your feedback on this event. We're continuing to facilitate discussions on the impact of healthcare reform and highlighting health plan innovation. So please email us and share ideas or any feedback for future events. So thank you all so much for joining us today.